Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, we are back and we are talking about a rather painful condition. This is gout, of course, and it can be quite debilitating and cause someone to be in significant pain, and that's probably an understatement. It, of course, is a buildup of uric acid, as Dr. Jitka Lom from Express Care was just expressing before the break, from overindulging. Let's now get to our viewer questions. Doctor, you ready?
Yes.
Interesting questions right now, and leading off is Neil from Tumon, so one of my neighbors, and Neil asks, Doctor, how do I know if I have gout, or if it's arthritis, or if it is both?
Oh, good question. Well, you know, gout is a form of arthritis. Arthritis just means joint swelling and inflammation, a painful joint. And gout would be one type. Then there's osteoarthritis that you get from just getting older, or rheumatoid arthritis. There are other forms of arthritis, but gout is a very common one. So how do you know that your arthritis is gouty? Well, you would know that maybe because it runs in your family, or maybe because only one joint is affected, and that's usually the way it is with gout. Or you might know it just because of the quality of the pain that you mentioned. It's like a burning or sort of a constant, very, very deep and very severe pain that may be different from osteoarthritis, which is more achy or stiff or sore.
And as we mentioned, it is hobbling even to, you know, the most burly of individuals.
Right. It can be very, very, very swollen and red.
Okay. This next question is also interesting. Likewise, Daryl from Mangilau asks Dr. Jitka Lom from Express Care, can cranberry juice really help my gout? Before the break, we talked about, you know, cherry juice, and cranberry juice is maybe known a little bit more for urinary tract infections, but is that effective for gout?
No, I think you're correct. I think it's more for urinary tract infections, and the black cherry juice, which I think is very difficult to find on Guam, is helpful for gout. Yeah.
And it's because the cranberry juice has certain acidic properties that are better for urinary tract infections?
Yes.
Okay. So,
and bactericidal.
All right, so stick to the black cherry juice. Do not go for the cranberry juice if you've got gout. All right, good tip.
And stop the beer, most of all.
Stop the beer. That would be very good advice for several people. All right, Lonnie from Dedido asks Dr. Jitka Lom, what foods are high in uric acid that I should avoid?
So the ones that are high are meat, and meat. And then we have shellfish, lobster, and shrimp, and then beans. Pork, of course, is another form of meat. Those would be the main ones. Oh, another one would be oatmeal. A lot of people eat that and think it's healthy, and not if you have gout. Things that are protective are milk and dairy products, and foods that would be healthy and safe for you would be green vegetables, a little bit of rice, and fish.
Yeah, so many people think it's related to shellfish in particular, and that's what brings on gout, but raw meat.
Any
or not
kind
just
of,
raw meat,
yeah, but it's
meat.
Typically, you know, short ribs or pork chops day after the barbecue, ham after Easter, and especially if it's rainy and cold, because when it's cold, your circulation isn't as good. The crystals will come out more easily. So in the cold and rainy weather, people will have more gout attacks too. Okay,
Dr. Lom, we go down to the southern village of Agate for our next question. Number 4 comes to us from the lovely Vivian, and Vivian writes, what medicine can I take to help reduce the pain and swelling? If she's already got it, how does she cause the pain how does she make the pain subside? Right, so she can take the over-the-counter medicines like Motrin or ibuprofen or naproxen. You can take those ones. If not, for some people, indomethacin is a prescription. It might work well for you. The famous one for gout is colchicine, which is a medicine that you take just for three or four doses of it, and it helps actually dissolve those crystals out. Colchicine, though, has a nasty side effect. It gives you really pretty bad stomachache and sometimes diarrhea or vomiting, so it's a big price to pay, and it's also gone up a lot in cost, so it's kind of a costly medicine. So I'm tending to give people a little bit of prednisone, which is a steroid medicine, again to reduce the swelling and inflammation. That will reduce their pain just for a few days. Sometimes you can even put a shot right into the joint. If it's hugely swollen, you can help them that way. But mainly the goal is to reduce your inflammation, handle the pain until your body flushes out the uric acid, and you do that with hydrating and eating the proper foods. Is gout more common in people that are physically inactive? Not necessarily, you know, with athletes and people. I wouldn't say. I don't think so. It's an equal opportunity offender. Yeah. It depends on your diet. All right. Well, let's stay in the South now. Chris comes to us from Talafofo and asks Dr. Lom, is it true losing weight too fast can cause uric acid kidney stones to form? So it's a compounded problem, evidently. It is, because you're right. When you have a high uric acid level in your blood, you also can develop stones, not just like crystals in your joints, but stones in your kidneys. Incredibly painful disease also.
So what can you do for that? Again, hydration, very, very important. And if you know that you have a high uric acid and that you're prone to gout attacks, especially if you've had more than 2 or 3 gout attacks per year, then you can be on a uric acid lowering medication called allopurinol. And you can take that every day for the rest of your life to reduce your chance of getting gout. And it's very, very effective and not very expensive. So it's a good investment for those who, even with controlling their diet, doing the best, still get gout attacks.
Okay, so let's wrap this up. And Ben from Jonia asks very quickly, what is the quickest way to make my gout go away? Any quick solutions?
Drink lots of liquids and get some medication, either the colchicine or prednisone or a steroid injection. That's the quickest way to make it go away. But it's still going to take 3 or 4 days up to a week or even 2 to settle down.
It doesn't matter, like with sprains or muscle pulls, if you elevate, if you're feeling pain in your ankle, if you just elevate it higher than your heart?
It can help a little bit. Heat tends to help more than ice in this situation. For people with gout, warming the joint tends to help with a hot pack, and hydrating is very, very important.
Okay, doctor, always a pleasure. Thank you so much for educating us on this. Certainly information all of us can use. All right, well, next week we will be talking about preparing for the new school year, so we want to inform you and invite you to send us your questions on our Facebook fan page. Just go to KUAM.com/Facebook, and you can do so. Stay tuned. We'll be back after this.